Breaking news at noon, 2 patients showing symptoms of a potentially deadly virus just arrived in Atlanta under strict medical precautions. Officials at the University of Nebraska, where the National Quarantine Unit is located, just held a press conference and say the pair may have been exposed to hantavirus from a cruise ship. They are now expected to be treated at an Emory University hospital in DeKalb County. 18 Americans are now back on American soil after traveling on that cruise ship that became the center of the hantavirus outbreak. I'm Cyria Sandlin.
And I'm Brooks Baptiste. Those passengers were sent to University of Nebraska's Medical Center for further evaluation, and from there, 2 of them were flown here to the Atlanta area. Atlanta News First reporter Chelsea Bimefore is live for us at Emory University Hospital. Chelsea, you were there as those patients arrived.
Yeah, Brooks, they were brought by Grady Hospital ambulances and they were escorted by police and other healthcare officials. They came straight down Clifton Road here and turned right onto the campus where they will now quarantine at Emory's Serious Communicable Diseases Unit. Our First Alert chopper did spot those 2 patients as they were deplaning at Atlanta's airport this morning. They were dressed in full healthcare gear and they were quickly loaded into ambulances and then started their journey here to Emory University Hospital. So right now it's unclear why just these 2 patients are here. The rest are still in Nebraska where they will be quarantined. But during a press conference this morning, healthcare officials in Nebraska told us that the 2 patients here at Emory are exhibiting symptoms of hantavirus. And we know that Emory has one of the world's leading containment and treatment units for dangerous infectious diseases.
And right now we have 16 people here. We have 15 in the quarantine center, 1 in the biocontainment unit, and then we have 2 down in Emory. Why did they go there? Because we knew somebody was symptomatic.
Now, the Georgia Department of Public Health says right now there is no risk to the general public, and they tell us that federal health care workers are taking every precaution possible. Reporting live from Emory University Hospital, Chelsea Bimefore, Atlanta News First.
Chelsea, thank you. And right now, officials were already coordinating with Metro Atlanta health leaders to secure a quarantine location.
The World Health Organization's Director General says the public should not panic.
We're in contact with U.S. colleagues, both in Atlanta and there are also some here in Tenerife. And they're monitoring everything, and they have made all preparations. They have their plan in place.
And just moments ago, Governor Brian Kemp spoke about the cruise passengers arriving at Emory University Hospital, saying they will get the care they need.
We're doing like we've done in the past with COVID-19. If you remember, we took patients and our fellow Georgians off of cruise ships at Dobbins Air Force Base, the Georgia National Guard, the local folks up in Cobb, and people like at Emory, Dr. Toomey's team, CDC. I mean, we're as prepared as any state in the country to do this, and it's just the right thing to do. I mean, you think if you were one of those passengers that was stranded, especially if you were from Georgia, you would want your state to come to your aid, and that's exactly what we're going to do.
Hantavirus infections typically spread through contact with infected rodents, but the World Health Organization says there's concern now it may have spread person to person aboard that ship. The
Atlanta-based Centers for Disease Control and Prevention classified the ongoing hantavirus outbreak at its lowest emergency level. So what exactly does that mean? The level 3 emergency designation means the agency is assigning disease experts to lead the response along with other staff. While it is serious, a Georgia doctor says it's not likely to become widespread.
People can get very sick, and usually the thing that causes death is they tend to basically drown within bleeding in their lungs. It's not something that you're going to walk by somebody that has it and get it.
So instead, the virus would usually spread through a long exposure to someone who's already been infected or by exchanging fluids with them.